This is Behind the Headlines, with behind-the-scenes analysis on issues affecting Pennsylvanians, sponsored by the Susquehanna Valley Center for Public Policy. Now, here's your host.
Hi, from Erie to Philadelphia and from Scranton to Pittsburgh, it's Behind the Headlines. I'm Charlie Greenewald, Senior Fellow of the Susquehanna Valley Center for Public Policy. I'm joined by my co-host, Maura Donnelly. Maura, welcome.
Hello, Charlie.
Why, since we were together last, there have been presidential debates.
Yes.
Did you watch the first debate?
I did. I'll never get those hours back, but I watched.
I'm wondering if this will be like Dallas or like the Bob Newhart show, too, where I'm going to wake up one morning and it's all a dream.
A dream.
Yes, I just wonder.
We can only hope.
Well, certainly in this election season and in the recent legislative sessions, one of the most important items, of course, continues to be health care.
Yes.
Health care for all the people of Pennsylvania. And to discuss that topic today, we're lucky to have with us Dr. Michael Consuelos, who is the Senior Vice President of Clinical Integration for the Hospital and Healthsystem Association of Pennsylvania. Welcome back to the program.
Thank you for having me again.
It's so nice to have you. You find that the legislature at this point is very concerned about opioids and opioid misuse, and we have a joint session being called of the legislature to deal with this. The governor has been concerned about this, and I know your association has been concerned about it. Would you care to talk about what the Hospital Association is doing in regard to this particular issue?
Sure. So first of all, I want to state that it's been a growing, we call it almost like a health epidemic, right? So, so being in healthcare, we don't look at this as a drug problem. It's really a health problem. And when you get the recent facts that almost 10 Pennsylvanians die of some sort of drug overdose every day.
Every day.
Right. It becomes a real issue. Imagine if that was some sort of flu or other illness and we had 10 Pennsylvanians die every day, we would be very, very concerned, and we are concerned. So we're joining, along with the governor and the General Assembly and our hospitals and other stakeholders like the Medical Society, to really try to find sort of a multi-pronged attack for this issue. And it's not just any one solution. So that's one thing I want to say. There's not just any one thing that we can do. And I think that's what the governor and the reason for addressing both houses was to see what both on the legislative side, but also together as stakeholders we could accomplish.
Well, before we get to what can be done and what is being done, I have a big burning question for you, and that is why? Why is this suddenly at epidemic levels? It seems over the last year especially, it has just mushroomed. What is happening? Why?
I think we've just come awake to a problem that's been occurring for probably a decade. Okay. And so I want to start off by saying that it's not a problem of inner cities, of people wanting to get high. This is a biochemical, it's a brain problem. So even if you have a patient, that we're treating a patient in the hospital who's totally, unfortunately a bad trauma patient, let's say, and we give them pain medication for day after day after day, their brain gets used to that pain medication. And they're not getting any high, right? They're out. And we have to take care to actually get them slowly off those pain medications, because we can actually see signs of withdrawal. They're vital signs, and they actually react. So that's what folks who become addicted to either prescription drugs or other forms of opioids, heroin, their brain needs it like water or air. And so we have to treat it like that. We have to treat it as a health problem. And it also happens to be associated with other mental health issues, behavioral health issues, so we need to address it from both perspectives. And it probably started decades ago when we started using more opioid medications to treat patients' pain. And we also became mandated to ask about pain, to document patient pain and address it there during that hospital visit or that episode of care. So we sort of ramped up the prescribing of opioids and have slowly but surely addicted the population of patients.
I think that social media has also brought it to the forefront a lot too, because it's almost daily you see those horrendous videos of people who have overdosed. And most recent one of a little girl trying to wake up her mom, people passed out in a car with a kid in the back seat. I mean, it's just really very, very sad. And I think that probably has helped to bring it to people like my attention, like, oh my gosh, what's happening here?
Yeah, and it affects everyone.
Yeah.
So it's not just an inner city problem. It's
right.
Rampant. We have rates of abuse and overdoses in some of our very rural counties that match up with our urban counties. So it goes across the board.
Wow.
Well, what is HAP and what are the hospitals in Pennsylvania doing to try to combat this misuse of opioids?
Right, so one of the first things we can do is actually adopt prescribing guidelines. Our organizations are the different departments, emergency departments and surgical areas and pain centers are adopting guidelines to really sort of limit the amount of opioids being prescribed, but also trying to go to other factors. Obviously educating both physicians and medical students and nurses, everyone in the healthcare team to make sure they're aware of the dangers, and in that educating the public and the patients as they go through care. I mentioned the behavioral health component, and that is also aligning both our medical care around this issue and the behavioral support that the patients can have in their communities. There's a new database that's available to physicians now, the prescription drug monitoring program. So it's a database that we can go in and actually type in the patient's name, their birth date, and find out how often and how many pills are being prescribed. So then we're also aware if maybe a patient is doctor shopping or trying to go out there and trying to get multiple prescriptions. So then we can actually discuss with the patient.
And that database is active right now?
It is, yeah.
That's
since the end of August, it's been.
I knew it was in the works. I'm happy to hear that it's working.
And remember, we had the Secretary of Health here to talk about it a week or so ago.
Yeah, the other important thing is the use of naloxone, which is a drug that can actually reverse the effects of opioid medicines, and putting those in the hands of not just physicians in acute care settings, but also in our EMS folks, into patients' families' hands, so that if they have a loved one that does overdose, they can provide life-saving
Doctor,
treatment.
how available is that drug, and how expensive is that?
Yeah, it's unfortunately one of the issues that's coming up is the price is slow as demand is going up. The price is slowly going up, and there's some efforts to try to keep that in control. So most recently, the Physician General, Rachel Levine, actually wrote a standing order. So any citizen in Pennsylvania can go to a pharmacy and actually get naloxone for a family member. So basically it's like a doctor's prescription that she has written, and pharmacists can fill those prescriptions. So any family member who potentially has that threat in their family should avail themselves of that opportunity.
So even though 10 people are dying a day, we probably don't have a handle on how many lives are actually being saved, do we? I mean, they've got to be.
Yeah, daily.
Absolutely. Wow.
And if we're losing 10 people a day, I was sort of blown away when I saw in 2015 the total number is 3,500 people.
Right.
I don't think that people in the Commonwealth have any idea that this many people are dying due to this epidemic.
Right. So back in 2014, about 2,500 people died of drug overdoses. That was basically the same amount of people that died from motor vehicle accidents. So, and then now that has been surpassed by over 1,000. So we're in the 3,500 people per year, and the projections are that's not going to slow down anytime soon.
Oh my gosh, this is crazy. Yeah. Well, we could probably spend an entire 3 days talking about this. But we would like to hear a little bit more about other issues that HAP might be working on right now.
Sure.
What do you have going on? Anything in the General Assembly?
Yeah. So one of the important issues that we're working with legislators is something called the Medical License Interstate Compact, and it's a mouthful, but basically it's a way to expedite physicians to get their medical license. And so why is that important here in Pennsylvania? Well,
in Pennsylvania.
In Pennsylvania,
okay.
Correct. But it's multiple states. So right now 17 states are part of a compact. So individual states license physicians. You can't license a physician from their state, but this compact, this agreement between states, allows states to facilitate more quickly the licensure of physicians across state lines.
Well, I don't think most people realize that if you're licensed to be a doctor in Pennsylvania, one can't then practice in Ohio?
That is correct.
I don't think most Pennsylvanians.
No, it's not like a driver's license. Yeah, it's not like a driver's license. Even though we're all pretty much educated the same way and pass the boards and our respective specialties, we actually have to apply for another state license. And so that can take 3 months or so to take place. And then you have to get credentialed with the insurance companies and your hospitals. That takes another 3 to 6 months. So the process could be 6 to 12 months before we can actually see patients. And that's a problem in some of our areas, especially rural areas that have problems recruiting physicians, especially specialty physicians. It's also an issue if we want to do telehealth. So if there are areas where there isn't a specialist nearby, but there's a hospital across state lines, vice versa, if Pennsylvania or a bordering state, you have to get a license to practice medicine in that state to provide telehealth, telemedicine services. So this would allow for physicians to work across state lines more easily and provide care to citizens across state lines.
And I think it's probably going to be even more than just the rural areas. I mean, people are so used to getting everything online. I mean, you might as well just talk to your doctor. You know, I don't think you have to be in a rural area to benefit from that kind of ability to reach out immediately and get some help.
Yeah, absolutely. Absolutely. And so, as we all know, the population of people over the age of 65 is growing very quickly, right? So, as baby boomer kind of booming.
It's called the silver tsunami.
Is a silver tsunami? Okay.
No, that's a new one, Maura. I have not heard that before.
I think it came from Martha Stewart, but don't quote me on that. But I love the term silver tsunami.
So the current figures look like between 2010 and 2020, about 500,000 Pennsylvanians will turn 65. So that's 500,000 folks who are, getting into an age range where chronic medical problems start to appear. And so we need physicians who can manage those problems and other medical providers. So that is, this compact will allow more ease of transitioning license across state lines.
Oh, that's great. And is it happening? Is it going to happen?
Well, we hope so. Yeah. So it's already. So yeah. We want to thank both Senator Tom Killian and Representative Jesse Topper for introducing legislation.
Okay.
And it's under consideration. So absolutely. And important is that sometimes folks in the state get kind of concerned if they lose control over some of the process, and it doesn't usurp any of the state's rights or malpractice Medical Practice Act to protect patients. In fact, it actually strengthens it, because right now, if there's we talked about opioids a second ago, if a physician is prescribing opioids sort of not the right way, let's say in Ohio, and they potentially lose their license, well, they can just go across state lines, apply for another license. If they didn't get reported to the National Data Bank, they can just change their license, practice, and pick up where they started. Oh. With this compact, there's going to be sharing of negative action between the state license, and actually you can find out if a physician who has a license in your state, who may be practicing in another state, has a negative action more quickly and electronically. Yeah. Right. So actually it protects patients even more by having that, you mentioned, with the internet, it allows for that exchange of information. Yeah. Right now, that does not occur.
Is that cluster of 17 states, do they border us?
So one does. So okay. West Virginia has adopted the compact, and most of them are sort of the Midwest and West.
Okay.
And so there are other states who are considering this. And my colleagues in other state associations are working very hard also to move this, because it really modernizes the licensing process for physicians.
Good.
Doctor, I know HAP is working on this. Can you give us a summary in 30 seconds of where the association is in regard to telehealth and telemedicine?
Yeah, so same thing. There's been legislation proposed and working through to allow telemedicine to be fully sort of described, because it's sort of not well described in what telemedicine really, those services can be done, but also then for allow payment for those services to physicians, which is important, because my time as a professional, like any professional, if I'm providing patient care face to face, I get paid, but if we're doing the same exact thing over an electronic device, providing that same, there's certain instances where I would not get reimbursed, and it slows down that progress.
Okay. Oh, good. I hope that changes.
Yes, we do too.
Well, we want to thank you very much for being with us today, and thank HAP for all the good work you're doing. And we will be back with the second segment of Behind the Headlines right after this. Stay tuned.
Behind the Headlines is brought to you as a public service by the Hospital and Healthsystem Association of Pennsylvania, helping hospitals provide healing, health, and hope to communities across the state. And by the Pennsylvania Business Council, envisioning a commonwealth in which residents enjoy a very high quality of life in sustainable communities. The council works aggressively to define key long-term policy strategies and solutions to make the commonwealth more competitive, creating and sustaining a better Pennsylvania. Additional underwriting provided by the Worrell Corporation Foundation, based in Carlisle, Pennsylvania, by the Edward H. and Jeannie Arnold Foundation, and by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business. Behind the Headlines is also supported as a public service by Daily Express, transporting construction, farm, and industrial equipment throughout the United States, and by Blackford Ventures, LLC, a private equity firm seeking to make significant investments in real estate, proven business enterprises, and their leaders. Find out more at www.blackfordventures.com. And by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Visit pahighwayinfo.org.
Hi, welcome back to Behind the Headlines. On this segment, Amar and I are going to be joined by Bob Latham. Welcome back, Bob. Bob,
good to be here.
You are the Executive Vice President of the Associated Pennsylvania Constructors.
That's correct.
Would you remind our audience who the constructors are in Pennsylvania, what your association is, and what you do?
Well, everybody driving around this summer is well aware of our members, or the people who we represent, because they're the companies that are fixing the roads and bridges, and particularly the ones behind the barrels and the Jersey barriers, trying to work and trying to make roads better and safer for everybody in Pennsylvania.
And this summer, Mara noticed your folks out more than ever. She talked about one construction zone after the other in her travels around Pennsylvania.
I don't have a problem with that. I may make note of it, but I don't have a problem with it because I know that good things come when they're out there working.
That's
well,
right.
We've been here before. We talked about the transportation. We talked about highway improvements and the simple fact is that with the passage of the funding bill several years ago, we're not building new roads. We're not building new highways. We're fixing existing ones, fixing existing bridges. We have an old system here in Pennsylvania. We have a growing population. We have a growing amount of travel, both truck travel and personal travel through the Commonwealth, and trying to accommodate that on the existing system that we have now. So that's what we have to work, and you have to get around, and we have to try to figure that out together.
Let's talk about those work zones a little bit.
Sure.
I don't know how many years ago it was that fines were doubled in work zones. Do you know? It was
Yes, well, I think that was probably 10 years ago or so, something
Didn't
like
work
that.
very well, did it?
I don't believe that. In
our
estimation, no, because you still have to have a trooper or a policeman there. You still have to be observed. When in limited circumstances now we are able to have police at a highway work zone, they're really there to try to wake people up, I guess, with the lights and all that. They really don't have the ability to pursue or fine you. So you can still blow through there without getting without any repercussions.
Not a real deterrent, a true deterrent.
It's not a true deterrent.
Right.
Well, I mean, the numbers that we have available are sobering, Bob. For the last 5 years, you have 10,586 work zone crashes. That sort of makes me afraid to be a highway worker. And 128 people died in those 10,000 crashes.
How about afraid to be a motorist? Now, one of the things that we've seen, we've done some research through our, we have a research foundation, and we went back and looked and asked the public, okay, now that we passed the funding bill, what do you think about the roads? Are we getting better? You know, how do you feel about this? And one of the interesting feedbacks we got is that motorists, people are really afraid to go of the highway work zones. There's sort of a visceral fear of going through that. Mostly fear for what is the guy behind me or around me? What's he doing? Am I? So we're really looking at that. We're working with PennDOT. We're working with the design community. We're working with the Turnpike on. Are there ways that we can maybe re-engineer some work zones? Is there better signage? Or is there better communication that can be done by motorists? But one of the conclusions is we have to slow people down. We have to get their attention to slow people down as they go through it. With the funding bill, we increased speeds on our interstates and on the Turnpike. You might have noticed the Turnpike's 70 miles per hour now. It used to be 65. Well, 70 miles an hour means 82, you know, and if you hit a work zone at 80, it's a fact. If you hit a work zone, then wants you to go back to 55. Most people just stay at that 82. That's unsafe for them. It's unsafe for the workers, and it's unsafe for you and me.
Well, we tend to think in terms of, this is all about the construction workers, but it really isn't. The majority of those accidents that have occurred have been the motorists.
Right, certainly. Our motivation as an organization that represents construction contractors is to make a safe work environment for the people who are trying to do a good job improving the roads and bridges. Their moms, their dads, their family people. These are good family-sustaining jobs, but it's a dangerous profession, unfortunately. However, you make a great point, Mara, that this is the predominance of the injuries are the people driving through them themselves, and most of it is because of speed.
So what are we going to do about it?
Well, we have. Funny you should ask. Thankfully, we have a number of members of the legislature that have looked at our neighbor to the south of us, Maryland, and looked at what they've done in implementing an automated speed enforcement. And in the vernacular, that means if you speed more than 11 miles per hour over the reduced speed limit. So, in other words, if you go more than 62 miles an hour through a 55-mile-an-hour work zone in Maryland, you're going to get a ticket that's going to be sent to you because you're going to get ticketed by camera.
So they're going to capture your license plate.
It's use of technology to capture your license plate and send you a ticket.
How long has Maryland been doing that?
At least 4 or 5 years now. It's been very effective. Anybody that's driven on the Baltimore Beltway, which is another road that's always under construction, so you can always test this out anytime you go down to Baltimore or go around it in order to get to Washington or point south. You can really see the speeds go way down, and Marylanders are crazy drivers. I lived there for 13 years, and we're pretty sedate up here compared to them. But boy, that speed goes down.
Has there been a corresponding decrease in number of accidents?
Absolutely.
And
they've seen
fatalities?
They've seen less and less accidents, less and less fatalities as a result of this. It's just a much safer environment. And probably getting a better quality of work down there too, because you're able to concentrate. The highway workers are able to concentrate on what they're doing. With Senators Dave Argyle from Schuylkill County and Judy Schwank from Berks County, Democrat, a bipartisan legislation introduced. Senate Bill 840 that would allow for it's a very limited pilot program, by the way. I mean, Maryland's bill is statewide, system-wide, any kind of construction. This limits it to interstates and only when highway workers are present. We argued against that last point because we think that the effectiveness will be again aimed at motorists as well as highway workers, but we're having a little trouble politically here in Pennsylvania. But the bill is out of committee, and it's poised, hopefully, to come to a vote in the Senate here in these limited waning days of the session.
Is the opposition to this sort of a Big Brother fear type of thing, that you're being filmed?
There is some opposition from people on that issue. There are some groups that say this is just a money grab, a way to raise revenue or a way to raise taxes. Honestly, what we've seen in Maryland is that it started out as with revenue, and each year the revenue has decreased because as people have slowed down, there are less fines that are levied, and there's no money coming in, and that's fine. Our interest, from our standpoint, representing the construction workers and the companies, is to get people to slow down to a reasonable, manageable speed, safe speed. And reduce accidents. It's really not about money. We just got a funding bill several years ago. We'd like to be able to safely implement that.
It's interesting that there would be some opposition because there's also some efforts to speed up traffic and help the flow better by, for example, Easy Pass, capturing your license plate and letting you just keep going.
Right.
And I think through most Easy Passes, if you go through and if you blow through it, and even turnpike tolls, they're going to get you.
Well, there is, it's funny you should mention, there is some legislation. Right now, there's no reciprocity with other states. And I saw a presentation by the Turnpike folks the other day and they're just trying to get the ability to go to other states and say, hey, we took a picture of somebody from New Jersey who blew through the Easy Pass, and we'd like to be able to have your assistance in finding them. They don't have that. And for some reason, there's some sort of legislative quirk or illegal quirk.
New Jersey found me one time.
Well, New Jersey finds you, but apparently we don't find New Jersey.
New Jersey people.
or the Turnpike Commission
and
can't.
I was not doing anything illegal. My Easy Pass was defective, so
maybe our laws don't allow the Turnpike to go after the New Jersey guy, but the New Jersey people come after you.
Crazy.
For example, there are other states as well.
Well, Bob, going back to Senate Bill 840 for a moment, there are a few items that your organization would like to see revised in that bill or changed. Is that true?
Well, the main thing, the main thing is we'd like to see it applied to all instances. Well, first of all, we'd like to see it more broadly applied, so you could use it on maybe limited access or even other roads, particularly when the speeds are up. So it's a fairly narrowly scoped thing. We'd also like to see the fines to be allowed to be levied at all times, not just when highway workers are present. Those are the two main things. But I would say right now, if that's what it takes in order to get the thing started, to allow us to see how it works here in Pennsylvania, we would be.
It could always be expanded.
Yes,
right?
exactly.
Okay, so got to start somewhere.
You got to start somewhere, and if there's concerns with that, we're certainly willing to accept the narrow scope of this bill just in order to get started and hopefully save some lives.
Now, in the past, when you've been with Maura and me on the show, you have also been concerned about some of the monies that have been diverted from the state license fund to support the state police. Well, where are we on that in the last minute and a half of the show?
Well, there's good news and bad news. There's now about $800 million that is being siphoned, if you will, out of the highway fund over to the 800 million, just shy of $1 billion. From the motor license fund to the general fund under the to pay for state police operations.
So that's $800 million that could go to the roads and bridges.
And really, maybe to put that in perspective, when the transportation bill passed, that number was 600. So we've gone up another $200 million, which is about 3 or 4 or 5 cents of the gas tax that was passed is going to prop up the general fund. I'm happy to say that the legislature did put a cap on that this year in the budget, and also a plan to walk that back, albeit more slowly than we would like to see it. But at least there's a cap. They've shown some action by the General Assembly, a recognition that we've got to stop this. We've got to stop this. So
that's good news.
So that's good news for us because we had seen this going up $50-70 million a year, over the last 3-4 years. So now, by law, it can't go up. So when the governor puts together his budget for 2017-2018, it can't go any higher than the 802, and actually. Starting in 2019, I guess it is, then it'll have to come down 4% a year. It's a slow glide down. Slow glide down, but it's going the right direction. It's going the right direction in my mind, anyway.
Okay. Unfortunately, we've run out of time. We want to thank you, Bob, for being here with us today, and we will see you next time on Behind the Headlines. Tune in then.